Wow, thank you so much. I want to thank you, Rahul, and everyone involved in coordinating the conference, and Dr. Stange also for his presentation and previously. I just put a few things here as a little bit of a framework overview of what I've been involved in a little bit. And I won't be sharing so much clinical studies, but rather a kind of exploration of this topic of music meditation as medicine, and primarily its role in changing the environment of the human body, holistically speaking, and that music meditation can be a pathway to access the transformations that come through changing the environment within a person. And so I'd like to go through this as a kind of exploration together, share some things I've been involved with, and then present some case studies. And of course, the conceptual and theoretical framework behind the whole endeavor here. So as a brief introduction, for those of you that might not be familiar with the field of ethnomusicology, it started off as an interdisciplinary field that included its main parent as anthropology and the other as musicology, but also included physics, cognitive science, and all those areas within cognitive science that include linguistics and artificial intelligence and neuroscience. And so medical ethnomusicology is something that came from a lot of my work. In ethnomusicology itself, it's basically looking at people, music, and culture, right? And here's a couple definitions that have been used recently. But medical ethnomusicology is this holistic field of research, teaching, performance, and applied practice that concerns the roles of music, sound, and the creative arts for healing, health, and well-being in cultural and clinical contexts. I kind of came to this field because I grew up as a musician. My father was a physician, my mother a nurse, and I had the good fortune to grow up close to where my mother worked, as she was the director of nursing at a skilled nursing facility. And so my brother and I ended up doing work in the summer there, taking care of the flowers, the lawn, all of the gardening and so forth. But after we would do that, I would go in and spend time with the residents, older adults dealing with all kinds of illness, disease processes, and healing processes. And what I learned from that experience in sitting with them, being with them, spending time, and playing music for them and with them often, was that I noticed incredible changes through that experience of sharing the music. And in fact, sometimes prayer with them, and often just staying in this rarefied space that I later would view as meditation. And I saw that there were specific changes in 5 key factors of a human being. And so we'll get into those in a bit when I look at the some of the theories and the models that I've been using. And so I'm just going to fly through here. If anything pops up as an interest to you, I'd be happy to talk more about them, and even through email later if you have a particular interest. These are just some of the things I've been involved in with my research projects and programs. And they range from things like children with autism to obesity to all kinds of stress and anxiety, mental health issues that come from that. Okay, let's see here. Well, too much. All right, let's just keep going. Here of the publications that I've worked on that come through my research, and these are 2 of the books that I did for Oxford University Press. The first one, this monograph, Beyond the Roof of the World, is an exploration of the traditional practices for healing, traditional medical practices in Tajikistan and amongst the Palmyra people that form an important group, a minority within the country, and that primarily live in this region of the Palmyra Mountains that cross Tajikistan into Afghanistan. And they practice specific types of devotional music, either in support of medical treatment or traditional naturopathic or herbal treatments, or on their own. They also serve as a standalone healing practice. The other one, the Oxford Handbook of Medical Ethnomusicology, is an edited volume of about 21 chapters. It has physician scientists, music therapists, ethnomusicologists, traditional healers, many people from many different fields and disciplines that are interested in understanding more about the dynamic between music, sound, and their potential role in healing. This is an edited volume published in Belgium that was done again with a group of people that is more for public consumption. And I've spent some time over the last years working on that, extending the academic research into the public discourse and making it available in terms of an applied sense for people that are not researchers or clinicians or practitioners. And here's a couple version of that book. Here's a couple textbooks that also feature my work and some music that deals specifically with music and healing. Some new trends, a kind of compilation of a lot of the research I've done over the last let's say 20 years, but not the last, let's say 5 years. Here's a couple other textbooks that specifically focus on this topic within academia and for students that are interested in pursuing that. And here's the last book that was mentioned by Rahul about the Meditation Manifesto, again, reaching out to people to help them practice and incorporate what we've learned so far. This bottom picture is coming from a course that I was teaching at HKBU in Hong Kong that had just a wonderful response, and it was overflowing, and all the students in this class, but also in previous years when I've taught it, universally people have positive changes in their health and well-being and in achieving their goals. So a key point here is that the experience of meditation and music meditation can be enlisted to access this elusive ability of the human brain and the human system as a whole to manufacture the necessary molecules to facilitate healing, health, and well-being. So one of the challenges is that music on its own is very complex and holistic in nature in the way that it connects to and impacts the brain and the body. So drawing conclusions about causal effects requires creative and critical thinking in research design. One of the key aspects here is the role that meaning plays in the potential of music to affect a positive change. And this is one of the key things that is missing in a lot of the research that is done about music, health, and healing. And we'll look at some specifics of that. So two key aspects of the framework I'd like to share that will hopefully generate some thoughts and some conversation. One is what I call the 5 factors of music, health, and healing, and the other is culture-dependent and culture-transcendent or universal principles and processes that underpin. So the 5 factors of music, health, and healing: goal achievement and transformation. These are, in the medical literature, it kind of started with George Ingalls, a physician and psychiatrist. I think it was 1977. It was in the 70s. He wrote an article about, I think it was published in Nature, about the change in a new model of understanding health and healing in human beings, but also in treatment. And that was the biopsychosocial model that I'm sure you're all familiar with. And basically my research, I took that and expanded it to include the emotional and the spiritual or transcendent, intangible aspect that also participates in the healing process. And admittedly, more difficult to measure, right? Let's keep going here. So what I noticed early on was that the relationship in the research and literature usually looked at a binary relationship. There was either music connected to healing or prayer and meditation connected to healing. But there was a missing link. There was a gap between the relationship between music and meditation, or prayer and meditation. And this slide comes from a program where I was looking at both dynamics of prayer and meditation, but the same thing holds true for just meditation. And the interesting thing is, when you read the material on music and healing or meditation and healing, there is almost always little to no description of the music itself and a kind of a critical engagement with music as a very active. My feed seems to be a little slow here, so just let me know if it isn't working. And so what I wanted to do with the music meditation dynamics model, in other words, the dynamic relationship between music and meditation in healing, health, and well-being, was to just bring them together and to show that, yes, we have the binary relationships for sure, but we also have this center here where all of these converge. And so the parameters of this model are four in nature. We have music and healing, meditation and healing, music and meditation in healing, and then unified music, meditation, and healing. And so we can get into more details about what that is, but for researching music, it's an important framework to have in mind because they all can participate in the process. The other thing is what I call cultural transcendent to universal principles and processes, aspects of what participates in healing, health, and well-being. And they are creativity, what I call music-mind dynamics, which is basically the music meditation dynamics model, but focusing on the brain and the mind. Neuroplasticity, psychological flexibility, entrainment, and embeingment. Embeingment is like a holistic embodiment. In other words, the changes that happen within a person have to do with all these aspects, the biopsychosocial, emotional, and spiritual or transcendent that a person experiences. The final one is something I call the human certainty principle, juxtaposed to the Heisenberg uncertainty principle. And I won't get into it much now, but I wanted a framework to be able to explore this dynamic. And it includes things like the placebo effect and a kind of deeper state of intuition, okay? But we'll get into that maybe if we have time. So here are the 5 factors. In other words, a human being has 5 factors that we can understand. There's the biological or the physical, there's the psychological, the mental, there's the social, and so we have the biopsychosocial, but also the emotional and the spiritual or transcendent. So health and healing also have these 5 factors, the biopsychosocial, emotional, spiritual. Music itself, and this is the key point, has these 5 aspects as well, the exact same 5 aspects. In other words, Music has a physical aspect, and it impacts our biology, our physiology, our neurophysiology. It has a psychological component. It impacts our thoughts, our cognition, our memories, all of these things. And you can think for yourself just quickly as I go through these, what are some of those aspects? In other words, let's look at the physical part. Music impacts your body. You immediately feel and experience a physical shift when you listen to music, especially if you listen to it with a specific intention in mind. We use it in sporting events, before exercise or working out, to get pumped up, to get the juices flowing. And of course, there's many other uses. I often remember this report on a new type of police tool that they would use. So if they were chasing a person, a criminal who had just, let's say, robbed a store, and instead of using a gun or a taser, they would use this large sound cannon that would emit a kind of subsonic frequency. In other words, very, very low frequency, that if they were in close enough proximity to the person, the criminal, they would shoot out this sound, and it would immediately impact their internal organs and make them feel nauseous and queasy, and they would fall over because of the sound relationship physically to their physical body. Psychologically, of course, we know that music, sound, can bring emotions of joy, of pain, of sadness, can make you happy, it can make you cry, all of these things through this intervention of music. As I said, with memories, it can bring up memories that you haven't thought of, and experiences, and even reliving that experience, in other words, of something from years ago. And it can help you to remember things and smell things and experience them that you haven't had in years. There's many more, of course. Socially, on the social front, music is one of the human practices that we do to bring people together, but also to push people apart. It relates to many of the aspects of the seven principles. One of them is entrainment, where two or more autonomous oscillations or rhythms or processes come together, and they begin to unite and they become one. This happens in the social sphere all the time when humans engage music. Emotionally, obviously, it brings the happiness, sadness, can bring all kinds of emotions to the forefront of your experience. In other words, all of these things change the environment of the human being. Spiritually as well, music helps us transcend a kind of beta dominant brain state, and helps us to experience other states of consciousness that we might otherwise not be able to experience. Here's some of the ideas with the interconnectedness. In other words, if we say the physical aspect of music or the emotional aspect of music, let's say, can connect to the physical part of the human being and can make a change in their psychological or physical health and well-being. So if we take this model and we just keep drawing the lines between all these, we'll see that there's this interesting dynamic between music and the human being. And so basically what that is, let's just say, if we have the 5 factors of a human being, the biological, psychological, social, emotional, spiritual, and we also have the same 5 factors of music and meditation, when we bring these together, we can start to see that there's multiple potential connections between these 2 models. And this has been borne out in a lot of research that I've done using a kind of adapted model from William Malarkey, who wrote a book called Take Control of Your Aging. And he had a PIERS, P-I-E-R-S, which was physical, intellectual, emotional, relational, and spiritual. So very similar. I kind of adopted that and then created this other 5 factors model to illustrate what's happening within a person. So in that survey, that instrument we were using from William Malarkey, the responses in all of them, plus lots and lots of journaling and sharing and interviews with participants, showed how they experienced changes in all 5 factors and also holistically. So the 7 universal principles and processes I want to share that in my work and research have been shown time and again to be the categories within which we can understand how music can be making this dynamic change in a person's state. So one is creativity. In other words, a human being's ability to create, not be a talented musician or creative artist or anything, but the ability to create. And this is something that I found is really important to emphasize so that people actually know they have this capacity. You know, one of the perspectives or the orientations within ethnomusicology is that all human beings have some musicality, some aspect of music within them. They might not call themselves musicians per se, but on a deeper level, not about being a trained musician, whether it's a traditional practice or a kind of institution of learning, but that we are musicians. So there's a lot involved in understanding that aspect that's very important. Of course, the music-mind dynamics model that I introduced, neuroplasticity, is something that's been shown that music affects change, improves neuroplasticity. Psychological flexibility as well. Music takes us into a state where we can see things from a new perspective. In other words, not be stuck in the same response mode that we normally have. Music helps us to move out of that into a kind of, by metaphor, I would say, a kind of quantum dynamic state wherein a person can make changes that they might not otherwise be able to make because they're not in the state to make them, so they can't actually consider them as possibilities. Entrainment, as I said, is where 2 or more autonomous oscillations or rhythms come together as one. It's a natural law, as is gravity and so forth. More about that if you have questions or want to explore that. I think one of the most interesting examples is where a newborn, or let's say a premature baby, has a weak heart. And instead of using a drug therapy or something else to try to help that heart be strong, the first approach ought to be to place that newborn with a weak heart next to another baby that has a strong heart. And so the heart of the child that is working well is beating at this rate, and the one from the child with the weak heart, as it is close in proximity, it will start to pulse, it will start to beat in the same rhythm as the strong heart. Another interesting example is women living in a close proximity, many women living together, for example, in a college dorm or in a home, wherever. Usually what happens is that their monthly cycles of menstruation will come together, and they'll all be on the kind of same schedule, unless someone is taking some kind of drug or birth control that interrupts that natural process. Many other examples, but and the human certainty principle is the other one. And like I said, we'll get into that if needed. So the process I've been working with, if I can just introduce briefly, is something I call the sea meditation method. And that's SEA, like the sea of the ocean. And that stands for to see with your eyes, to be able to envision the outcome that you want. Then the E is for experience, to experience that outcome. as real and true during your meditative practice. And then A is to take action. So SEA is to see, experience, and act, to take action on that. There's a process behind that where we do assessment and in-depth exploration to bring meaning, honest meaning for the person to the forefront of their mind and their emotion, of their heart, and experiencing the outcome that they want. So there's a process involved to make it coincide, to make it meaningful for the person. Okay, so let's just look at a few case studies here. I'll just kind of go through here. I think my time, Rahul, how much time do I have left here? I'll just keep going and wait for a chat, or if you pop in there with your voice is great. So you can see a bit about Jane. Oh, sorry, go ahead.
You can go. You have some 10 minutes to think.
Okay, great, thanks. So this was basically her state, and most important, she was at risk of early onset diabetes. She was stressed out, had a lot of anxiety and depression. She was taking lots of med, withdrawn, and she was basically using first prayer, personal effort. She went to physicians, many kinds of therapists, and had no results. As she went through this process, using the C meditation method, first of all, she defined what healing meant for her. She created a clear vision. She attached that vision to the music. In other words, she attached the meaning of what that meant to the music that became central to her healing practice, which was a music meditation practice. So she had results in all 5 factors, and the biopsychosocial, emotional, spiritual factors. She developed a healthy self-image. She had love and appreciation for herself. She came out of the spectrum of obesity into a healthy weight, got off her meds, and was totally transformed. It was truly miraculous. And so, you know, these kinds of experiences that people would share with me and that then I would look at in my own research were universally positive. And then there was, of course, a range of impacts that people would have. Sometimes if they were in the care of a physician or another health professional, this would buttress what they were doing. It would support what they were doing. Other times they had lost all hope and they would just use this approach, and it was amazing. Here for Maria, you can see what she had going on in her being, and she also used the same method, and she attached to her music the meaning of forgiveness, being whole, healthy, pure, and free. She did this every morning and evening and throughout the day. And so basically the C meditation system, it has one morning and evening practice that's called the C meditation, and then it has 2 other practices. One is the 3 breath meditation that is about 30 seconds, and another one called flash meditation that is 5 seconds. And so once they start the foundation with the C meditation practice, morning and evening, which is minimum, you know, we like to get them up to 15 minutes, but often, you know, 15, 20 minutes we like to get them to, but often they go much longer. And so people get into this practice and often they start to enter that altered state and they stay there because of the experience they're having for half an hour, sometimes 45 minutes, an hour or more. Let's see here. Okay, so Jan, here's a few things that she said. She's tried all kinds of medicine and doctors, Chinese medicine as well. Nothing was working. She had some benefit from the Chinese medicine. And so she experienced an incredible change as well. Her ulcers became inactive, the number reduced, no pain, no depression, normal stress, and was in the 90th percentile of the peers modified survey. We have done some research measuring things physiologically, heart rate variability with blood pressure and some other measures, but the research that's going on continues to, little by little, show the positive impact that music can have and meditation can have, but there's still this gap in looking at them together and also being able to measure the physiological or neurophysiological markers of improved healing processes and increased health and well-being. So let's keep going here so I can, let me quickly share about Samantha. So she was due for some surgery that she had done some similar surgeries before, and we worked on this just for 7 days straight before her surgery. And what we did was help her prepare for her surgery, help her participate in her surgery, and to participate in the healing process after her surgery. So here are some of the things that she said. I basically provided her with some music that I had made using the Chinese bamboo flute and some other indigenous traditional instruments from several different countries, from Nepal, from a Native American flute that was a Plains Indian Lakota styled flute, and some instruments from traditional practices in Africa. And so it was a mix of things that I've played and learned over the years, and that's what she was using, along with the meaning that she was linking to that music. In other words, preparing for her surgery so that she would go into it with all of her internal faculties and capacities to participate in the surgery from, let's say, an energetic state, for lack of a better word, but also post-surgery to then participate in her healing. And so here are some of the things that she shared as she went through the process. And so I won't read these to you. You can just kind of scan them quick, and I'll be happy to talk more about them later. So in the music meditation dynamics, it's connected to these 7 principles and processes. In other words, when we engage music meditation, we're engaging a state of creativity, okay? And we are engaging a state that encourages neuroplasticity, and then sitting upon atop of that, psychological flexibility, entrainment and enviement as well. The entrainment part is the aspect of having that vision clearly in place, how you want that healing process to go, and then using the meditation with the music. And because of music's profound and holistic connection to the brain, the meaning of that gets coupled to the musical process. In other words, the meaning of healing, health, and well-being that the person puts specifically in their own terms links to this experience of music and meditation and brings forth the change they're looking for. And so please, I'd love to connect anytime. Here's ways to get in touch with me. There's my email, social media, you can pretty much check out there, and then my telephone number, as well as Signal and Telegram. So thank you so much, and I'll just stop there and give us a chance to talk if we have some questions. Thank you so much.
Oh, it was like, wonderful presentation, and a lot to know about music and healing. And that's a like, traditionally the people do a lot of spiritual activity where they connect the instrument with the spirituality. So that's a thing. So that's there in, at least in, I know, the Indian culture. There's a lot of things are there where spirituality is connected with the music and musical instruments. So, your study that then reflects that same.
It's a wonderful field, and we had in that handbook of medical ethnomusicology, I also invited Dr. Rajan Sankaran from India, who was a physician and homeopath there, who has been deeply interested in music. And the Indian system of music is quite interesting because each raga has different rasa or emotional content connected to it. In other words, there's meaning connected to each raga. And so some for morning, some for evening, some for healing this and that. And many cultures have some kinds of associations this way. But in the Indian classical music, um, there is this very well organized system where these things are already connected in the music. So people have this expectation that this music will do this for me if I engage it in the proper state. And so it's a very interesting system of music as a foundation for researching this kind of topic because it already has those associations. The other thing that's very interesting is that because the meaning is central to music's potential to effect change, that meaning exists at a very personal level. So we do have these broad group culture levels, but we also have the more important, which is what that music sound, that experience means to the individual. And so this is one of the difficult aspects because it's very personal, but it's one of the most important to incorporate.